Hello, thanks for tuning in today. Today I'll be talking about primary assessment of a patient. You should start your primary assessment with a general impression of the patient. During this, you'll need to gain the patient's gender, age, and weight. Then, assess the appearance of the patient using FEDSO acronym. FEDSO stands for facial expressions, eye contact, dress and hygiene, how they speak to you, and their odor of their body or breath. Next, you should assess the patient's work of breathing using the acronym WARF. WARF stands for words per sentence, abnormal sounds, retractions, and nasal flaring. Then determine what color the skin is. Is it red or flushed, white or pale, or blue or cyanotic? Using the last three steps, you can determine whether the patient is sick or not sick. Next, you can determine the patient's responsiveness and level of consciousness. Use AVPU to determine the patient's level of consciousness by assessing whether the patient is alert to verbal or painful stimuli or if they are unresponsive. Verbal would be just speaking to the patient and them reacting to what you are saying, and painful would be doing a sternal rub or pinching the earlobe to get the patient to react. Then unresponsive is self-explanatory. The patient does not react to your presence, to you speaking, or to painful stimuli. Next, you need to determine the patient's chief complaint and any life threats to the patient. Find out who called 911 for EMS assistance and why they called. Also, take note of who called. Now, you're going to assess the patient's ABCs and DE, starting with the airway. Is the patient's airway open and secure? If it is not open, you will need to do so in one of two ways. On a non-trauma patient, use the head tilt chin lift technique. And on trauma patients where spinal immobilization has been taken, use the jaw thrust maneuver. Then you should insert the airway adjunct. Then you go on to breathing. Assess the patient's breathing. How many breaths per minute? How fast is the patient breathing? Do they make any noises when they breathe? When they take a breath, does their chest rise and fall equally? These are all questions you should ask when you're going through your breathing. If the patient is having issues with any of these previous questions, initiate oxygen therapy. Then you move on to circulation. To assess the patient's circulation, check the patient's skin color, temperature, texture, and turgor. Then assess whether the patient's pulse is too fast or too slow. Start with radial pulses, and then if you cannot obtain a radial pulse, assess the patient's carotid pulse. With circulation, you should assess for any major bleeding, and if there is any major bleeding, control it. Then you go on to disability. Assess the patient's PEARL. PEARL stands for pupils equal, round, and reactive to light. Then you should expose the patient's body as necessary for your assessment. Next, you're going to identify the patient's priority and make a transport decision, whether you're going to load and go or stay and play. If the patient is critical, load the patient and transport to the hospital immediately. If the patient is non-critical, you can stay and obtain a more detailed assessment before transporting. This video has explained how to take a primary patient assessment. Thanks for tuning in.